Welcome to this episode of United States of Sick Care. I'm your host, Tamara Young. This is a podcast where we put healthcare in quotation marks when we talk about the United States healthcare industry, and we poo-poo all over it through the lens of experts that I interview and their experience and their expertise in their respective fields in health and wellness. And medical disclaimer for today's episode, as always, this is not medical advice. I'm not a medical professional of any kind. And while my guests are, in this case, my guest today is a registered nurse of 14 years. She worked in a hospital ER setting. And she shares her experience, observations, and opinions about a variety of things, one of which in this episode is particularly sensitive because she does talk about her opinions of the pokey industry. And so just want to throw out a medical disclaimer for all of the censorship overlords out there on social media and big tech that this is not medical advice. As always, medical decisions are between you and your trusted medical provider. Hope you enjoy this episode. Loud. Okay, welcome to the next episode of United States of Sick Care. I am joined today by someone who has become my friend and who is actually way more credentialed and qualified to talk about these topics than I am. Hence the reason I'm doing this podcast and bringing on actual experts with lived clinical experience. This is Alissa. Welcome, Alissa.
Thank you. Thank you so much for having me.
Yeah, thank you for making time. Alissa is on Instagram at This Holistic Nurse. She is, as the name suggests, an RN. She's been a registered nurse since 2006, and she worked in a hospital setting in the ER. In 2020, she left that setting after 14 years in that career. She now works at as an IV infusion nurse for an integrative doctor. And she and I also cross paths. We work with the same company, just teaching people how to shop differently for their everyday household products, shop less toxic, safer products. So she is a total nerd with me in the holistic space, just from a little bit different perspective, as of course a former clinician and working still in a clinical setting as an IV infusion nurse. So I'm excited to talk with you today about a variety of things, but just as kind of to level set your experience and what you bring to this space, I would love for you to just talk everybody through what brought you to nursing in the first place and just kind
Yeah.
of the high points of your journey in your 14-year career and what ultimately got you out of the hospital setting.
Yeah. So thanks for having me. My name is Alissa, this holistic nurse on Instagram, and it's just such a pleasure to be here. And I just love talking about this stuff. So thank you for having me. But yeah, so I started my career in 2006. I was a brand new little baby nurse at age 22, working in the emergency room and in a trauma center. That all started with I played competitive sports, and I thought for sure I would go into like physical therapy or do something like that. But it was my high school anatomy teacher that was like, "Hey, have you ever thought about nursing? Like, I think you'd be a really good nurse." And I had no idea what nurses did. I literally thought they just passed pills and that was it. So I was in for a rude awakening. I had never stepped foot into a hospital until I entered nursing school. So I had no idea what nurses did. I was just like, sure, that sounds like a great career. I'm going to go for it.
You didn't
So
come from a family of medical providers or clinicians?
my dad is a retired fireman. So he did like emergency stuff, EMS stuff. So that's kind of what led me into emergency room care is I was like, okay, well, maybe that would be cool because my dad and I can have that in common. So
Oh, interesting.
yeah. So basically just did 14 years I spent in the emergency room. Like I said, I was also a trauma nurse. So saw a lot of just evil, terrible things that no one should have to see. And that of course affected me greatly in lots of other areas of my life. But I woke up tremendously about 10 years ago, and we'll kind of get into that. But I was your just like eager nurse, totally indoctrinated, didn't question anything, just went through nursing school. I was like a yes, ma'am, whatever, just to get the assignment done. I kind of idolized and glorified doctors and put them up on a pedestal, which is crazy to say, but I didn't have a relationship with the Lord at the time either. So I was just kind of searching for answers and was kind of just like a lost little sheep. Didn't really know where to turn. And anything that the medical community said, I took it as truth. I took it as that's what it is. That's valid. That's correct. I'm not going to question it. That's just how it goes. So my whole world was rocked about 10 years ago. I can get into that if you want me to, Tamara.
I would love that. Before you get into what happened 10 years ago, what the impetus was to wake you up, as you put it, I would love to know when you say you were indoctrinated. I would love to know what
Yeah.
you mean by that. Like, what was when you entered nursing school and started your career in a hospital? I think you probably touched on it a little bit with just kind of taking the medical community at large as Bible.
Yeah.
But what were you indoctrinated into in terms of like how people should approach their health?
Yeah, so it was very much like a band-aid effect, is what I like to say. It was like, here's your diagnosis. We're not going to discuss how the patient got there. We're just going to discuss treatments and how to mask it and how to fix it. So I went through nursing school learning all these various, like congestive heart failure, people that have like pulmonary hypertension, all these things. We never discussed root causes. It was just like, well, here's your 5 meds that can treat that one thing. Now you're going to see what's best for that patient. And I didn't really realize that until I had my own health battles later. I was having mental health issues and I was like, there's a reason why this is happening. This isn't just coming out of nowhere. I don't want to just take a medication for it to get better. Surely there's things I can do to get better. So, and also indoctrinated in the whole vaccine schedule too. That's a whole nother story. But, people say, well, they're the medical professionals. They know they wouldn't give us things that are harmful to us. But truly, we took my course on learning about the CDC schedule was 1 hour long. It was 1 hour long. They put up all these slides up behind us. So here, watch this, look at this. Don't question it. Any mother that questions this, they're crazy. They don't know what they're talking about. This is for the greater good. And that was the end of the conversation. We weren't allowed to talk about it, question
That,
it. We just had to accept it.
and that's what I talk about a lot is what you're describing is we have this perception, this false perception that a doctor or a nurse or any sort of medical provider, we should take their word for it because they are educated on these things. And I think you just hit on a really important fact that demonstrates what I talk about a lot, which are the silos in the medical field. You were in the silo, your particular silo was as a nurse and what you were being taught as a nurse. And everybody has their own silos. People who work, in research are in their silos. People who work in big pharma are in their silo. People who work in nursing are in their silo. Heart specialists are in their silo. And so, in your respective silos, for you to be a specialist and to be really good at what you do, it requires you to learn the ins and outs of what you're doing and take everything else outside of your silo as Bible.
Yep.
So I think that's
Especially in emergency room care, because we are really good about knowing how to handle emergencies. So we know a little bit about everything. So every single little disease that might present to us, we know a little bit about it, just enough to get them upstairs if they need to be admitted, if that
yeah,
makes sense.
yeah,
So
just enough to keep them alive.
yes.
Essentially. Yeah.
Yep, package them up, stabilize them, and send them upstairs where they can get their, maybe their cardiac ICU care or their neuro ICU care. Our job is just to stabilize. So I was really good about like problem solving, getting that patient stable, getting them to where they needed to be. But did I ever really question it and think of, gosh, why did this happen? How did this happen? Surely this could be preventative, but it
Yeah.
was just a lot of cause and effect. It was just
A lot
like,
of how this happens, but also missing that piece of like, what now? What about the future of this patient? Is anybody thinking beyond the medications and the interventions we're using to stabilize them and how that's going to impact? Like, are they going to be on this stuff for life?
mm,
Um, there's not a lot of path looking to the past or the future really when you're in those kinds of fields.
right. No, that's very true. It's basically just to stabilize them, get them out of the hospital, and then what happens from that point on is between them and their primary care doctor.
Right.
Yeah.
Who aren't, did they ever, by the way, have like call you up and, do a little conference with all of their past providers to figure out how to treat that patient?
No, never.
No.
Never. And
Um,
we all have different charting systems too, so that makes it real convenient also.
yes, it's so fun. We've just with the girls, we got a new pediatrician for a lot of the reasons we're talking about here today.
Mhm.
And it's so funny because medical people ask for medical records and we have this perception that it all gets consolidated and there's a seamless handoff provider to provider, and when we took her to the urgent care that somehow gets compiled with their histories. And no, it doesn't. A lot of times doctors are relying on what you fill out on the form. And how many times when I was on 8 prescription medications and I didn't even know which supplements I was taking, I was like writing down like 2 of them because, you get tired of writing them down. So
Mhm.
doctors treating me didn't even really know which meds I was on.
Yeah.
You lie about your lifestyle because I don't want to tell them I'm drinking a gallon of vodka a day, you know?
Yeah.
Um, well, tell us what happened 10 years ago. I'm dying to hear.
Yeah. So, life was just kind of going as it was. I was working in the ER, married, had 2 kids. And I remember it very distinctly. My sister called me, and my sister and I are very close. This is my younger sister. And she just lives about 40 minutes from me. And has a new baby. And she's like, I need to meet you for ice cream. Like, let's just meet up. I need to talk to you. And I'm like, okay, yeah, absolutely. So I kind of drop everything. We meet. And she's like, I think my son's been injured by vaccines. I was like, what? What do you mean? Like, I've never even heard of vaccine injury. I'm like, what are you talking about? Like, show me, what do you have? So she pulls open her phone, and it's been going on for months. And she shows me before and after photos. This is him before, this is him after, just like 24 hours after his appointment, his wellness check. And she has all this records. And she's like, he's not the same kid. He's not the same kid that he was before. And I was like, okay, I thought maybe there's behavioral issues. Maybe she just parents different than I parent because her kids like wouldn't listen like my kids would, or whatever the situation.
Yeah.
But really looking at it and diving deeper in, absolutely, her son was completely injured. So he lost all eye contact. He lost his speech. He started having sensory issues where before he loved the bathtub, and then she would give him a bath and he was screaming like you were like melting his skin off. Just like these terrible things. His diet changed, his walking changed, all these things that was like, okay, clearly 1 + 1 = 2 here. I believed her immediately. I knew she had everything to lose, nothing to gain by sharing this story with me. And I had an obligation to do more homework. It was my sister. I love her. I would do anything for her. So of course I'm going to listen to her. And subsequently, at the same time, one of my best friends came to me, similar situation with her child, all within a couple months of each other. My whole world was just rocked because I was like, this goes against everything I've ever learned. I started asking some of the physicians that I work with, like, hey, have you seen this before? Do you know what this is? Like, do you think it could be related? And their responses said it all. They were dismissive. They said, absolutely not. You can never prove it. But I'm like, but he was perfectly fine right before his appointment. So then I started playing back all the pediatric patients I've seen in my head as an ER nurse, just like all the seizures, all the, we call them alties, where they literally have like an episode where they don't act the same, as the same type of child, or a SIDS baby, or all these different things. And I'm just like, holy crap, looking back, they all have one thing in common: a recent wellness check with their pediatrician. All of them. That's a standard question that we ask. Are they up to date? When was their last visit? And I would say 9 times out of 10, they said, yes, they're up to date. And we were just at the pediatrician's office yesterday or this morning, or. So that's kind of what forced me to open my eyes. And at that time, that is when you were able to get on the internet and pretty much research anything. Anything was there. It was still on the CDC website. You can look up all the ingredients and all that. But
Yeah.
as the years have
Before
gone
things were
by,
scrubbed to the degree that they are today.
so hard to find that information now. Yeah.
How old was your nephew? Which
So it started at 3 months, and he was almost 2. It was like his 18-month appointment when she shared everything with me. So
I was
her
gonna
mama
say, I was
got,
gonna ask if it was 18 months. This is an area, my chiropractor who was the last guest on this podcast introduced to, because we have a 2.5-year-old and we have a 6-month-old. I'm just going to speak freely. And then, as I told you, for the YouTube gods, I will edit out as necessary so that this content can live on YouTube, and I will direct people to where they can hear it in full.
Mhm.
Um, but when our youngest was 4 months is the last time either of them were pokeyed. And that is because at that 4-month appointment, I just started to have a gut feeling. It's when I entered the world that you and I both crossed paths in. And I just started to wake up. And as a mother, you don't have the luxury anymore of like, see no evil, hear no evil. Like, you have to kind of like
really trust your intuition and trust the evidence right in front of your eyes, quite honestly. And
Yes.
we took her in for her 4-month appointment to the health department because you could get them cheaper there. And I never knew which combinations she was getting. They would give us a piece of paper afterwards, be like, this is what she got. These are the diseases they prevent. Had no idea like risk profile in terms of like different combinations or quantities or the age of exposure, none of that. And at 4 months old, I just remember before she got her vaccines having, sorry, try not to cry, having this like gut instinct to run, like just to grab her and
Mhm.
run out of the building. And I was, of course, because I grew up with a mom who's a nurse, a dad who worked in the hospital system my whole life.
Yeah.
I was like, this is insane. Like, you don't do this. You just trust them and you're compliant. This is irrational of me. And she got a high fever for a few days after that. And I was also, I received a certain, what is called a vaccine, but is actually, as we know now, just another pharmaceutical. I don't know why it is conveniently called a vaccine, but it's an mRNA
Yeah.
intervention. I got
Gene
that series
therapy.
when I was pregnant with her. So she's been exposed from the time she was in the womb to different ingredients that are commonly used in vaccines. And as I understand now, that toxic load can really build and build. Um, and they're little tiny bodies that have a hard time detoxifying. They don't detoxify the same way our adult bodies do. So age of exposure really matters too. And I didn't know any of this. And when she got a fever and she was just so sick for a few days, I remember thinking in my head and getting kind of angry because I was like, wait, y'all are telling me I have to make her sick in order to make her better? I don't understand this. And that's when I really started looking. And the long story short is my chiropractor introduced me to a few documentaries and resources where you can actually dive into some of the actual research. A lot of which you've mentioned is buried or masked and like the way it's ultimately reported out, and a lot of it's removed. And so you really have to dig. Um, but on its face, it's pretty obvious, like what the risk profile really looks like. And a lot of it, once I started watching that, you can't unsee it.
Yeah.
And I can't tell you how many times since then, I literally, the day after I watched one of the documentaries, I sat in my mom's Bible study the next day. Three of the women in my Bible study, there are about 8 of us. Three of the women's children have, they're on autism spectrum disorder. And one of them was telling a story about just how heartbreaking it was to watch her child lose language and lose this and lose that. And I was like, how old was she? And she said 18 months.
Yeah.
And I just hear it everywhere now. It's
Yeah.
18 months, 18 months.
Start to
At the
regress.
it's alarming because at the current trajectory, I think it's estimated that by the year 2050, we'll see 1 in every 2 children, half of children will have autism.
Yeah, I believe it. At this rate that we're going, I absolutely believe it. And Tamara, that's awesome that you had that intuition and you really dug into that, because I had that intuition and I ignored it. It never felt right for me to be giving up my babies, my perfectly healthy baby, to get these shots in them. So my sister went through this and I still didn't wake up. I still continued to give my kids shots because you think, well, it's just them. My kids have been fine so far.
Yeah,
My
it's
kids
an
have been
anomaly.
fine. They need
Yeah.
to go to school. So I did for both of mine. They're now 13, almost 13 and 10. I continued until my son was 4.5 and my daughter was 5 going into kindergarten. But I'll tell you what, the moment that we stopped, my daughter stopped getting sick. We have not been to the doctor since. I'm not
Yeah.
even joking. My daughter's almost 13. She has not been to the pediatrician since she was 5 years old.
Oh yeah. Now we're like, what eczema? What allergies? Why can she drink milk now and she couldn't before? It's incredible. Why do we not have chronic respiratory infections
Yep.
anymore?
Yep. Because you learn how to support their body naturally, which we'll also talk about, I'm sure. You learn a different way. You realize, okay, this system is broken. This isn't helping my kid. Why does my kid have to get sick to get healthy? This just doesn't make sense, right? And then
Yeah.
you're like, clearly there's a different way. And then that's when you start researching, and that's what leads you down that different path.
Yes. So this was a very personal thing to start out with. It was your sister, it was your family,
Yeah.
and that at least opened your eyes, kind of put a crack
Yep.
in the narrative for you. How did you reconcile that with your work as an ER nurse?
Well, I was really angry. Like I said, I started having kind of those flashbacks of all those patients. And I'm just like, gosh, I'm being complicit in this. Now that I'm awake, now that I've done my research, how am I going to continue my career? Because I'm thinking, gosh, I've got like, 20, 30 more years of being a nurse. Like, how am I going to do this? So how I reconciled that is I started talking to my patients, educating them. I refuse to give shots to patients in the emergency room. And even when I switched hospitals, I switched to like a major HMO hospital, which is like the most well-known HMO hospital in our area.
I'm
Uh,
sorry, wait, why would they be giving shots in the ER? Like if patients weren't
yeah,
up to date?
weird, right?
They
Yeah,
would, no, I'm serious. They would give
yeah,
shots to children in the ER if they weren't up
yeah.
to date.
Not if you're not up to date. Well, if you're not up to date with tetanus, say you get a cut on your hand or something, and oh, when was their last tetanus shot? And the mom would be like, oh, I don't know, I don't have the record. So, okay, we'll just give it to them anyways, something like that. Or flu season. Oh, have they had your flu shot? No, but they're here because they have a respiratory infection. Yes, let's give them a flu shot because that's
Girl,
something.
I feel like I could be out buying bread and someone's like, while you're here, do you want your flu shot or your COVID shot? And it's like, I just want to buy bread. Thank you.
Yeah, yeah. Keep your
Yeah.
poison.
Interesting. Okay. In the ER. Wow.
Yeah. And that was what went through my mind too. I'm like, no, I'm an emergency room nurse. I'm here to provide emergency room care. If they want these shots, someone else can give them to them, or they can get it outpatient. You're here for your emergency. You're here for your abdominal pain. You're here because you're going to surgery. The last thing your body needs is a shot, right?
Yeah. Not for an a la carte menu of add-ons. Yeah.
Yeah.
Wow.
Yeah, so
Okay.
I was very angry, but it propelled me into more research, trying to figure out how to find my voice while staying employed. That's always a challenge, right? Because obviously I was the black sheep, but started having break room conversations with other nurses. I'd be sitting there eating my lunch, and for instance, I started homeschooling my kids out of all this in 2019. I started homeschooling my kids. So people are like, why are you doing that? And I'm like, well, they're not going to get these shots anymore. And they're like, well, what do you mean by that? And so led into a great conversation, and people were like, you could see them thinking and their wheels turning. But at the same time, they think, well, not me. My kids are fine, while their kids have asthma, type 1 diabetes,
The same things you
ADHD.
thought. Yeah.
Yeah. So that anger, I turned it into action, and I started kind of like having these little conversations on the side, but ultimately led to I had to get out of the hospital setting because it wasn't for me. It was like a spiritual battle. I felt like it was deceiving people to play along with that narrative, and I could no longer be a part of that.
So you're talking about the COVID pandemic. So you're talking about the year 2020,
Yeah.
and everybody has their COVID story, but yours is interesting because your COVID story involved you still working as an emergency room nurse. So talk about that. What were you seeing? How did things change in your work environment?
Yeah. So, well, about December, January, so December 2019 leading into January 2020 is our typical like flu season, right? Usually from November till March is kind of flu season. So we were seeing really sick patients with respiratory issues, and we're like, what's going on? We don't really know. We started hearing about this stuff going on in China, and we're like, everyone's ears started perking up. But it was, I would say it was like typical flu symptoms, and it was your typical patients that were either obese or had all these other underlying issues on chronic medications, et cetera, that were getting really sick, that maybe needed further intervention. Everyone else was fine, they'd go home. But we would test them, for influenza, and we would test them for RSV. It would come back negative, and we're like, what the heck is this? This is weird, because there was no quote unquote COVID test at that time.
Yeah.
So things started progressing, and it was getting close to March at the time.
I'm sorry, just to clarify, you're saying you were seeing these trends before the first official case was declared in the US?
Yeah. Oh,
Okay.
absolutely. Yes. Yeah, we were seeing these symptoms that totally aligned with what the symptoms that they said were indeed COVID. So
Okay.
yeah, we were seeing that in like around Christmas time. I vividly remember that. And then, the news started pushing the narrative of this China virus, right? This is before the shutdown happened. So this is like February and March. And then leading up to the shutdown, I'm in California. So things are wacky here anyway. I came to work one night, And our lobby was completely empty. Like that never happens, like completely empty. I took a photo of it. I still have it on my phone. And I was like, this isn't what they're saying it is. This something else is going on. I don't know. So I just like sat with it. I prayed about it, talked to, I had one like-minded coworker that I can confide in, and we're just like, what do you think this is? And that same night, I had a pediatric patient, and this pediatric patient came in with flu-like symptoms, right? He had like a fever, sore throat, just like random body aches. And his dad had just traveled from China, and he came in with his mom. And the reaction of the emergency room physician was said everything. It was hilarious. He came in a full-on PAPR, which is almost like a spacesuit, to go assess this little kid, mind you, who was like 8 years old. And he scolded me outside in the nurse's station for me not wearing any PPE. And I was like, I'm going to use common sense here. This kid is clearly fine. He's sitting there, he's talking. It's my risk. If something's going to happen to me, I'll take that, but I'm not going to dress up in a spacesuit to go assess this child. I'll go in and I'll talk to the child. So that was my last shift that I worked, because then our shutdown happened like a week later, and I couldn't be a part of that.
Yeah.
So things were not making sense. Things were not adding up.
Sure.
Yeah, I kind of wish, a part of me wishes I would have stayed just a little bit longer, because I felt like maybe I could have blown a whistle. Maybe I could have been that one to be like, yeah, guys, wake up. This isn't what it is, like, here's all the evidence. Quit looking over here at the shiny object. But God pulled me out for a reason. So
Don't get me wrong, I would have loved for you to kind of be a fly on the wall and report back what happened after that point. But ultimately, it's about you and your family. And
yeah,
glad you got out when you did.
thank you. I am too. And it was the right time. It was the right time.
Yeah. So now you talk, and the reason when I introduced you, I mentioned your Instagram handle is
Yeah.
because the holistic nurse, her Instagram content, the things that she posts are incredible. So it's a lot of
Thank you.
some opinion, but it's just all grounded in really practical tips for people. So what can you talk about? Actually, before we get into like holistic, maybe there are some overlays here anyway, but you and I share a mental health history.
Yeah.
You struggle with depression and anxiety, and you mentioned that kind of played a role in you getting into the holistic space. So
Yeah,
what happened?
definitely. Yeah, so it's just so awesome. First, like, all glory to God that I could even have this conversation, because I was so ashamed of it for so long. Like, it was something I stuffed deep down and didn't want to talk about. But because being an ER nurse, I would see the crazy people, right? And I never wanted to be one of the crazy people.
Right, right. You treated
Um,
people like me who loved, like I had a, like, I don't know, I had a loyalty card at the local ER. Yeah.
that's awesome. Yeah, so my history with anxiety first started. My husband and I traveled abroad. We went to Europe before we had children, and this was back in 2009. So in 2009, we're in Italy, and I, like, this wave of panic came across me, and I never felt that before. And I was like, oh my gosh, what is this? I just thought, I'm tired. I'm in a different time zone. Like, I haven't slept well. This was before smartphones. And for some reason, our hotel rooms didn't have an alarm clock. So I was so afraid that I was like not going to wake up. We were going to miss the tour bus. We're going to be stuck in Italy, like all these things. So anyway, I get back home from that trip and I couldn't shake it. It was like this crazy anxiety. And then it turned into depression. And this was in my early 20s. And I never experienced anything like it before. And so trying to figure it out, I had to take time off of work. I literally like was panicking driving to work, like all these things. Um,
Tell
and
us
then,
about, describe when you say then the depression set and what kind of symptoms, what did depression feel like for you?
yeah, so first it would start out with, it would always start off with anxiety first. I would get this like apprehension and this like sense of doom, and like, what am I doing? I can't do this. I'm not meant to do this. Who do I think I am to be doing things like this? And then all those like thoughts, that like hamster wheel, would then sink in, and then it would turn into depression for me. And that would feel like I'd feel worthless, because at this point, okay, well, I can't go to work. Like, oh, well, gosh, okay, well, what can I do if I can't go to work? Like, I can't function and do a 14-hour shift like this. And then, gosh, I'm a bad wife. Like, I can't even go to work. I can't even cook. now I can't even do laundry. I can't even run to the grocery store because I'm so depressed, So it was just a vicious cycle. And like my husband was so understanding through all of it. And I had my parents and my sisters and like friends, and we were just all trying to figure it out. And it came to the point where I had to go to therapy, obviously. And in therapy, truly, I felt like it made things worse because then it starts digging up things from your past. And you're like, no, 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 I don't want to talk about that. Like, this is my problem here. But I never realized I held on to a lot of things from my childhood. I grew up in a dysfunctional house. My parents stayed married for 30 plus years. My dad has addiction issues. And there was not physical violence, but always yelling and, bad stuff was happening during my childhood. Me being the middle child, I've always been kind of the peacekeeper. And so I was always just trying to keep the peace. And I always felt like I was walking on eggshells. And lo and behold, I never dealt with that. And those feelings started coming up in my early 20s while dealing with all the trauma that I was dealing with at my work. So it was just things I was suppressing over time. And so the depression for me was debilitating. It was like my whole body hurt. It was like effort to take a shower.
Yeah,
It
I
was
remember
effort to get up off the couch just to go make myself food. Like I'd feel hungry, but I'm like, no, I don't want to make a sandwich. That's just too much work. Forget it. I'm just gonna lay here,
that's the best way to describe depression to me is like, is it hard to force yourself to brush your teeth? If
Yeah.
so, I know what that feels like. Yeah. And it makes sense that you would have that the cycle would play out that way for you because as you describe your middle child experience, like you were the one you had this pressure on you to always be good. You were the
Yes.
one who had to be good
Yes.
and to be fine, you know?
Well, yeah, and my older sister and I are 13 months apart. So she and I grew up and kind of mirrored the same life. Most of our life, we played the same sports, we had the same friends. And then in high school, her senior year, she ran away from home. It was tragic. Like I was like, where'd my sister go? That's a whole nother story for a whole nother podcast. But because she screwed up so big and my parents were so focused on her and what happened there, I had to be perfect even more so because
Yeah.
I felt like I had to make up for all her shortcomings because, oh my gosh, she ran away. We don't know where she is. Like, we don't know if she's safe. So I like, okay, took on all that and was like, okay, I'm going to handle this. I'm going to do what I need to do. And that kind of put me into like a type A type mentality where
You
that's why
can't
I
afford to
finished
fall
nursing
apart.
school.
Too many other people are, you cannot
Yeah,
afford
yeah,
to lose it. Yeah.
yeah. I had to hold it together. So I battled on and off with depression. I went on medication and didn't really do anything else. I started exercising a little bit more. I've always exercised my whole life, but I was like, okay, well, I'll make an effort. I'll go to the gym. I'll put on my calendar. Um, and just thought, okay, I'll take these pills. I'll be fine. And I did. Somehow I just dug myself out of it, but 6 months, 8 months, a year later, I would fall back into it. And it was the same pattern. And this happened from age, I would say 24 till 30. So 6 years. And I probably had about 5 episodes of really bad where um, I contemplated not wanting to be here anymore. I just thought like I was, my kids, they're better off not having me. I can't even drive them to school. Like I have to have my neighbor drive them to school because mommy can't even function. So yeah, a very dark time.
Really easy for your mind to go to that dark place.
Oh gosh. And I
But
never,
when you would slip back into it, was it just more of an acceptance of, well, this is the way I'm wired and I just ride it out? Or were you talking about, was the path always like, well, let's adjust meds or go on more meds?
yeah, it was me being in denial that I didn't have a problem, me taking myself off the meds, and then the cycle happening again. And then
Uh,
towards the, yeah, can you relate to that?
a little bit. Yeah.
And I'm a nurse, so it's fine. Like we're the worst
Right.
patients. We're the worst.
Yeah,
Like
you really are.
I could figure this out. I know better. I'm fine. But all this changed, honestly, like I said, I didn't have the Lord earlier in my life. I grew up knowing there was a God. My parents grew up going to Catholic school, but they did not model what a godly marriage looked like, what a godly home looked like. We knew of God. We knew there was God. We never went to church. We never prayed. I didn't know that you had a relationship. Like, I didn't know what that even looked like. So I surrendered my life to the Lord. I remember it vividly. I was in a deep depression. I was laying on my bed. My mom, my kids, my husband were out in the living room, and I just locked myself in my room. And I was just so desperate. And I just remember just like falling to my knees, try not to get emotional, and just like arms just like stretched out, and was just like, I cannot do this anymore. Like, God, I can't do this. I don't, if you hear me, like, just change this, because I give this to you. I cannot do this. I cannot function like this anymore. And my kids deserve better. My husband deserves better. And in that moment, I just felt like a wave of peace over me. And I know it's the Holy Spirit now. And it didn't fix it immediately. It wasn't just like, oh, Jeannie, like, okay, everything's fine. But I felt like he took that burden so I could heal. So that's my story with that. And honestly, like, I've tried the meds, I've tried all that stuff. At that point, I was still on medication, but me surrendering my life to the Lord and then me diving deep into holistic medicine is what cured me. And I have been healthy for the last almost 9 years, praise God. So
Before we talk about your holistic path and healing, let's talk about what you just mentioned, which is two words I love, which are desperation and surrender. They kind of go hand in hand, I think. Some people scoff when you talk about any sort of religious or spiritual experience that involves being desperate, because it's kind of like, oh, you're so desperate and weak that like you're vulnerable to that. Desperation is a gift.
Yes.
And I really admire people who can choose to have a high bottom in their level of desperate. Like I choose to be desperate enough for the Lord.
Same.
But that what you're describing, that surrender, and how you said it wasn't like a genie effect, like everything just got good. That's the beautiful thing about the invitation to me, is like the invitation of Jesus isn't come, surrender everything to me and you won't struggle anymore. It's literally like, I promise you will struggle, but if you surrender everything to me, I will give you a life that you couldn't even plot out for yourself in your wildest dream if you tried your best.
Yeah.
And it's like you still struggle. And then when those same attacks and those same tendencies and those same feelings come, it's just when you've surrendered your life in that way, there's just a whole new perspective you have on that. Like you can kind of like observe that and breathe and like release it, because you're like, I have help now.
Yes.
The
The ultimate healer. Honestly, I had tools in my toolbox now that the enemy couldn't take from me. The enemy could take away, he can make me, think I'm worthless and that my kids are better off without me. But those, now looking at that, those are not from the Lord. Like the Lord does not say those things to you. So it's like, now I have tools in my toolbox. I have my Bible, I have prayer, I have worship, I have, all these things. I have the fruits of the Spirit that I could try to live up to and attain. And it's like, there is nothing.
People speaking truth into your life. I know that you have that.
Yes. Yeah. Got to surround yourself with the right people. And I've cut out a lot of people as the years have gone on. And I'm sure you can attest to that too. But I never want to forget that desperation. Like, I'm getting emotional, but I could put myself back in that place. Like I'm looking down at my bedroom where I was. Like I go to bed at night and I remember that. And I never want to forget that, because that's what keeps me hungry every day, to be in the Word and just to be healthy and to have that holistic mindset. Like, okay, mind, body, and soul. Like if one thing's off, these other two things are going to be off too. So just keep going, keep fighting the good fight. Like everything's going to be okay. Jesus wins, so.
It's such a beautiful story. And I'm so like honored that you shared it here. And it's crazy how much our experiences mirror each other.
Yeah.
But that's just the way truth works. You see little synchronicities in everybody's stories.
Yes.
Because it's a really beautiful, loving God that created us.
Absolutely. And I'm able to open up to you and be vulnerable with you. Like, yeah, it's a little bit embarrassing, but it's like, I never want to forget that desperation, like I said, but we can have these conversations. Like I've only met you in person one time, but we have that bond in Christ. Like we are sisters. So it's like, I felt that right away. So of course I'm going to share my testimony. I want your audience to hear this, because if it just helps one person, like to me, that's a success right there.
That's plenty, or plants a seed in one person, so they have something to come back to later when they need it. It's Yeah, I love you, and I can
Yeah, I love
relate
you
too because
too.
I say like I'm pretty open, and yes, it is a little bit embarrassing still, but I ignore that part of it because the truth is I was drinking a gallon of vodka a day, cutting myself in a bathtub, trying to find ways to die, completely hopeless. And I don't say that to be provocative. I say that because I know I was convinced I had no hope. I was convinced there was no life left for me. I borrowed on the hope of somebody else who really pushed for me to get some help. And I just did it to kind of placate somebody else for a minute, thinking like, well, what do I have to lose? But like I know I tell people that because I'm like, I know the feeling of being convinced you have no hope. And I know it's not true. Because if it were true, I would be in the grave, but I'm not. And so I get it. Like there is an end that many people come to where if they're suicidal, it feels like there is no way out. Either like I'm just going to do what I'm doing as a way to kill myself, or I'm going to actively make a plan to try to kill myself. But either way, like it feels so convincing when you're
Mhm.
there that there is no other alternative. There's no goodness left for your
Yeah.
life.
And
And I
I've
just know now it's just not true.
It's not. It's not. And the devil would want nothing more for you than to act on those things, you know. And I've never attempted to hurt myself, but definitely those thoughts came to my through my head. I mean, my husband and my mom had to like take all the weapons out of the house. Like it was like I was in that deep of a place, you know. And I verbalized like, yeah, I would rather just not be here. And when I made those comments, yeah, things got serious real quick. So
Yeah.
yeah, but you're
Glad you
just
have
that
people around you to
desperate.
help. And it's so much. One of my very best friends she's a therapist and she's struggled with that too and been able to vocalize like this is where my head's going. And I don't know about you, but when I was there before my moment of desperation and surrender to God, when when this person was pushing me to get help, I remember feeling a very tangible battle of good and evil. It
Mm.
was really bizarre because I felt was like hopelessness and darkness. And when I started to consider getting help, all of a sudden it was like I was an observer of the literal angel and demon on my shoulder fighting. And I was like, whoa, that is weird. I literally feel two forces fighting inside of me
Wow.
for this decision.
Because it's a spiritual battle. That's what
It
it
is.
was.
I wasn't
Yeah.
even aware of anything happening on a spiritual level until I was like convinced, like I'm going down this dark path. There's nothing left for me. And then when I started to see, no, maybe there's a little hope, it's like the battle was on
Yeah.
inside of me and I could feel it. It was like I could almost touch it because it was like happening. And honestly, that's one of the things that got me into treatment because I was like, this is strange. It's like I'm all of a sudden, I'm not just in the darkness. I'm like stepping out and God's giving me this opportunity to like observe the spiritual battle that's happening for my life.
Wow.
And it was just strange. Like it didn't feel like me anymore. It felt like there were forces fighting. Does that make sense?
Yeah, absolutely. Because there were forces fighting because you were getting closer to accepting the Lord, and the enemy knew that. He wanted you in his pit of hell. He didn't want you feeling better. So yeah, that makes absolute sense.
Yeah, and if I'd heard this story, if I'd heard somebody try to articulate my story, I'd be like, yeah, they should probably go back on some meds because they're crazy. But when you reach that end, you start to become aware. I think it's like a gift to start to be aware of the spiritual realm
Mhm.
that we're all living in.
Yeah.
And it helps open your eyes to a lot of other shenanigans in our
Yeah.
world too. So
Yeah.
where did holistic healing come into play?
Yeah, so it actually came from my sister, my younger sister, the one that healed her son. So my sister came down and she's just like, I've tried all these things for her son, and she was already seeing like an integrative pediatrician at that time trying to heal him from all his injuries. And praise God, he's going to be 12 and he's doing amazing. He is doing amazing. So he has really just some eczema and some sensory issues, but other than that, you would never know. You look at him and think he's just a normal kid, you know? So she came over and she just started bringing like her diffuser. She just left it there, all her essential oils, started rubbing oils all over me, brought all her vitamins and started cooking. She's like, you need nutritious food that's high in magnesium. You need to be eating whole foods, nothing processed. Like, this is what you need if you want to get better. And I was like, oh, okay.
You're
Well,
like, okay, hippie.
yeah. I was like, you're gonna stay, right?
Yeah.
Yeah. So that was just like, what do you mean you can heal all these things with nutrition? And, you know, and of course we can't say that it heals it, but let me tell you, doing that was life changing. Just knowing what supplements I was deficient in, eating whole nutritious foods, not eating sugar, anything processed, staying away from caffeine, all that stuff. I slowly started to feel better. And then I started a new job. And then at that job, I worked night shift. So I worked day shift forever. I worked day shift for 9 years. And then I had to go to night shift. And my meds I was supposed to take at night before bed. That's what I was used to taking, right? Because I was still taking my meds for anxiety and depression.
Yeah.
And I was like, oh, I've got to figure this out because I can't do this. And I was like, you know what? I'm feeling so good right now. I don't recommend this, guys. I did not consult my doctor. You should always consult your doctor when going off of medications.
Yeah.
I started weaning myself off, and the rest is history. I've never even looked at him since.
Yeah.
But I still do all the diet stuff. I still take all my supplements. I make sure I sit out in the sun, you know, all those things that I wasn't doing before. So,
Yeah, that's so interesting. That's the way it happened with me too, is for me to go off of my 8 prescription drugs, it came in tandem with me cleaning up my diet, my lifestyle, the products I was using, all of that. And it's this big, when you say holistic or anything that isn't like in the kind of big food, big insurance, big medical kind of way of thinking, people are like, that's like it's a completely different way of life. Honestly, you guys, it's changing one thing at a time. It's just
yeah.
one thing at a time. Like when it comes to products, like I changed out my cleaning products, and this is what I love about your Instagram page too, is you probably way more than I do on my social media, but you do a really good job of laying out like, here are just really practical things. You change over these products. When you run out of these products, you replace them with something different. You know, nutrition wise, I was like, you know, I'm going to start eating organic leafy greens. And then I was like, I'm going to stop buying things with seed oils. Then I'm going to buy organic produce. Then I'm gonna, you know, and it's like
Yes.
one thing at a time. I didn't throw away everything in my pantry. You know, I didn't overnight stop giving, you know, all of us goldfish and fruit snacks and dyes and all of it. It's just, you look back several months later and you're like, whoa, making one change at a time, you know, because I can't decipher all of food labels and all of, you know,
Yeah.
the nutrition world all at once.
Yeah, it's a
Just
lot.
one thing at a time, and kind of follow your intuition on, you know, like for me, I notice a massive behavior change whenever my toddler, my oldest, has food dyes.
Hmm.
I notice a massive behavior, and I've had ADHD symptoms my entire life, and I've seen some tendencies in her, but it like her food, man, sugar and dyes really impact her behavior. She turns into a monster, and I
Yeah.
love her, but like, wow, you're a different person. And so
Yeah.
like, you know, I followed my gut, and I was like, that's going to be one of the first priorities for me. But other people, you know, their priorities might look a little bit different. But
Mhm.
how do you speak to that, like to people who are, I guess, a little bit more entry level, like how they can shift their mindset around like
Yeah.
the way that they're living and eating?
Well, it definitely is a mindset shift. And I think just understanding the the toxic overload, the bioaccumulation. And if you understand bioaccumulation and how that happens with our liver, so our liver is our filter. Our liver does an amazing job every single day of filtering out things that don't belong there, whether that's something in your food or the products that you're putting on. Your liver does great. But the society that we live in, with everything being processed, everything having all these chemicals and fragrances and all these crazy, you know, ingredients in it, our livers are pooping out by like age 30, whereas before they used to poop out like at age 70. So we have to understand what bioaccumulation is. And if you can understand that and that there's a need to change, because you have to understand that first. There's a need to change. We live in a society where we are bombarded with chemicals. If you want to live a long, healthy life, you need to change that. And that's also what I love, Tamara, about the wellness box, is they just make it so simple for us, where it's like a one-stop shop, over 450 products, cleaner, greener. They don't contain all those junk ingredients. So that's where I like to get people who are interested, start here. If that seems overwhelming, okay, start with your cleaning products. If you ran out of Windex, never buy Windex again. That stuff is junk. It has ammonia in it. It has dyes in it. It's not safe to inhale. Try the cleaner, from the wellness box. So I like to do baby steps, but you have to first identify that there's a need. And bioaccumulation is the biggest thing, is just realizing, like, how many chemicals as a woman do we put on our body a day? How fast is it absorbed through our skin? Our skin is our largest organ. And some women don't even think.
Yeah, we're breathing it, we're touching it, we're absorbing it, we're eating it. It's
Everywhere.
and it's unavoidable. Even the cleanest, crunchiest people cannot avoid toxins at some point. So you want to, where you do have autonomy, to use that autonomy in a really empowering way. And bioaccumulation, I have to admit, I haven't heard of bioaccumulation, but I think it's a different way of phrasing what I tell people, which is like, trace amounts is a trap. Trace amounts really add up when you consider how many of those products you're using and inhaling and eating before breakfast. So
it's the same thing. It's just toxic overload. It's just a fancy word for toxin overload. And yeah, exactly. So people that feel overwhelmed by it, and don't get me wrong, my sister had been on this journey already for several years. So I was just like, oh my gosh, what are you trying to tell me? Like, she's like, just start with this. Just start with this. Start buying organic vegetables, like you said. Start buying organic milk. And so now, like you, I would just recommend, like, if you run out of something, replace it. Because if you don't, some people are like, nope, I want to get rid of it. I just found out seed oils are terrible. Fine, get rid of it if you can afford to go buy new stuff. But if not, wait till you run out of something and replace it with a healthier option. And I think that that's very doable, because you're going to need the product anyway.
Yeah, very well said. Well, I like to, before we close out, I mean, this is called United States of Sick Care. I do love to poo-poo all over our healthcare model in the US, which involves, of course, not just the medical community, but the academic community, the food industry, the pharmaceutical industry, the medical device industry, all the industry, big insurance. I like to poo-poo on all of them, but I would like to ask you, like, for people listening to this podcast or watching this podcast, what do you want people to understand about our United States sick care model, and the biggest kind of step they can take to opt out of that system?
Yeah, definitely. It is a sick care system. It's a Band-Aid healthcare system. They're not looking to find the root cause. So if you want and you're content with having hypertension and taking a pill for it and never discovering that you have control of that, you have control if you have type 2 diabetes. If you want to just take a pill, then ignore what I'm saying and just continue to go to your primary doctor. But if you're tired of that kind of model, being healthy is an investment. Unfortunately, a lot of integrative and functional doctors, they cannot accept insurance. And the reason is it gets kicked back to the patient. They will order labs and do things that the average provider won't, and their hands are tied by insurance companies. So you're going to choose your investment. Are you going to invest now and try to live the healthiest way? That starts in the kitchen. That starts with your supplements. That starts with your cleaning products. That starts with getting out and getting fresh air. That starts with your mental health. That starts with maybe doing IV infusions at some point. That starts with seeing a different minded provider, maybe a chiropractor. That's all an investment. That's all going to be out of your pocket. Or are you going to ride along this healthcare model and then invest at the end when you're laying in a hospital bed and you're on 20 pills and you don't know how you got there? So it's a broken system, and it's going to be broken as long as all those companies that you mentioned, the FDA, the CDC, Big Beef, dairy, all these companies remain in bed together. We are never going to fix the system. So I say, if you're aware of this and you see that there's a problem, find a way out, because there are providers that are looking to find a different way. Integrative health and functional health is the way to go. And there's a bunch of doctors looking to exit the matrix of the hospital and looking to start those practices.
Yes, there are really good providers out there. We have alternatives. And I think you put it really, really well, that the system is not changing, not anytime soon. In my belief, probably not in my lifetime at all, but you can beat the system. You can opt out of that system and create a new one for
Yep.
yourself and your family. That's
Yeah.
really cool stuff. Okay, one more time, and I'll record another outro to tell people, like, give people links and things like that. But you can find Alissa on Instagram at This Holistic Nurse. Does a lot of Instagram live with other people. She posts a lot of like really, really helpful content for the space. So especially if you're like just curious, you're just holistic curious. She's a great person to follow. But I appreciate you taking the time today to tell your story and just impart some of your knowledge from being one of the insiders and now a fellow outsider.
I'm a total outsider. I've been an outsider for a long time, but yeah, thank you so much for having me. Thank you for doing what you're doing. This is amazing.
Awesome. Thank you, Alissa.
Thank you for joining us today. If you enjoyed this episode, please like, comment, please rate and review the podcast, and subscribe so you stay notified of new episodes. And to follow Alissa, check out her Instagram page at This Holistic Nurse. She posts a lot of great content, some Instagram lives with some other experts. And it's a very educational and informative account. And if you have any questions about any of the resources, products, tools, anything mentioned in today's podcast, you can email me at tamarayoungconsulting@gmail.com. See you next time.